Oh, Robin,
Hi
long
there.
time no see.
Hi, how are you, everybody?
Good. Hey, John from Home Connect and Larissa.
Hi there. How's it going?
Good to see you. Hey, Donna Craig. I see you called me. I'm so sorry. I was like trying to log in.
Well, I have a conundrum. It seems like lately these COC meetings coincide with the mandatory staff meetings that I have to go to at 3 o'clock. And so I was going to try and toggle back and forth if I could, but I was going to suggest thinking in my head that I could send somebody else, but we all have to be at these mandatory staff meetings. So this would be the second time that I wasn't there, and I don't want us to lose our membership thing. So I don't know, maybe there's something we could work out. I don't know.
Yeah, it's a good discussion. Well, let's try to put our heads together and see if we can come up with a solution. I know that the CSC meetings used to be at 2 o'clock and that got changed. So that's probably why you're running into this.
Probably, yeah, because I remember at 2 I could always jump off like at 2 minutes to 3 or something like that.
Yeah.
And I don't think with my computer I can toggle back and forth. I don't think I can be on Microsoft Teams and Zoom at the same time. So
yeah, well, if you have two screens, you might be able to. Do you have two screens?
I do not.
Oh, okay.
Yeah.
Okay.
So I'll just take myself off camera and I'll mute myself, and then I may have to leave and then maybe jump back on.
Okay. All right. Well, Mara sees you here, so she can mark you.
Okay.
You can do one on your laptop or computer.
I'm on mute too. Sorry, what did you say?
Oh, that you could attend one meeting on your computer and one meeting on your phone.
Oh, that's true. I didn't think about that. Oh, you're so smart.
Thank you. All right.
Okay. I think I'll leave this one and do my computer with work, and then I'll come back on. Okay.
See you later.
Bye.
Here. Is that Kimberly? Hello, Miss Kimberly.
Hi, Karen.
Good to see you, my dear.
I came up with some great ideas today, so maybe tomorrow we can talk.
That sounds great. Love it. What else do we have? I'm sure if I'm missing you guys, it's because I don't see you. It's not because I'm not saying hi to you, so I apologize. And oh, there's Ben Howdigy and Miss Rashana. Okay. It looks like we are at 3:03, so you probably want to go ahead and jump in and get the meeting started. Team, are you ready?
Yes, we're good. We're ready.
Okay. All right, everybody. Can you believe it? Did you wake up today and say, oh my gosh, it's October 25th? And I know in all of our CSE partners, this is like one of the busiest times of the year because you guys are all probably just diving into all of your holiday initiatives, right? So you feel like you're busy on steroids. So anyways, thank you for all the amazing things that you all do, public-private partners. So blessed to be able to work with all of you. Want to welcome you to our Continuum of Care meeting. For October the 25th, we are going to dive right in. I did see our Madam Vice Chair. There she is, Miss Michelle Davis. Hello, Michelle. So with that, I'm going to hand the ball to Marielle so that she can lead us through roll call.
Yes. Thank you, Karen. Madam Chair Karen. So I have dropped in the chat the Google form. I'm going to drop it again just in case not everyone received it. And I'm watching our responses come in. We are almost at quorum. So I would say we just give it a few more, maybe 1 or 2 more minutes for people to log in.
I better do that.
And then
I
if
didn't do it.
anyone, oh, there we go. If anyone's having trouble with the form, please let me know.
One minute here. Sorry about that, guys. Right. Get back to you guys. Okay. All right. Did you say we were at quorum?
We are almost there.
Almost there. All right.
Almost there.
Okay, so let's go ahead and go on down. While we're waiting for the rest of you all to get yourselves logged in, I'm super happy about this process. It makes it much easier for everybody. So thank you again to HWS staff for implementing that. We're going to talk about new members. This is always a super exciting time on the agenda because I love, love, love to see new members. And we'll know, and if you don't know, the way that you become a member is just to ask the staff. You can talk to Marielle and, you know, mention you want to start attending the Continuum of Care meetings. And if you express an interest to become a voting member, you just need to attend 3 consecutive meetings. And there's a process that you go through to fill out a letter, which is on the CFC Continuum of Care website. So any of you that are on that weren't aware of that, super easy process. So what I would like to do is talk about this, I almost said this morning, it's this afternoon, to welcome the new members. So I'm going to mention we have Renewing Hope Strategies, the Emmanuel Project, the Riverside County Veterans Services, and United Educational Academy. Are any of you that I just called here with us today right now? Any new members? James, did you want to say hello? Which organization are you with?
Hi, I'm with Renewing Hope Strategies.
And what does your organization do? Tell us about yourself.
Yes, well, we're an organization, a nonprofit under the umbrella company called Renewing Hope Family Counseling Center. So the Renewing Hope Strategies nonprofit, we have 2 mobile units that we're going to be rolling out soon within these next couple months. And we're going to be going to different areas in Riverside County, particularly where there's the unhoused, so we can reach the unreachable. We're going to be providing mental health services such as therapy, medication management. We're going to have psychiatric mental health nurse practitioners, licensed clinical social workers, associate social workers, and community health workers. So we're going to be going out providing therapy, signing folks up for services such as IHP, and just trying to fill in the gap, the mental health gap out there for those who are unhoused.
That's great. Thank you. Welcome. Before we see if there's anyone else, did you say, what region of the county are you covering, James?
We're going to be doing a community needs assessment, but particularly we're going to be focusing on Moreno Valley and Riverside. But
Okay.
within these next couple months before we roll out, we're going to see where there is a significant need, and then that's where we're going to start targeting. And then we're also going to be doing events every month. And so we can have events for the community to come and they can meet other organizations and stuff. So it all going to boil down to where the need is, but we're going to try to reach different parts of Riverside County.
Thank you. Madam Vice Chair, did you have a question or a comment?
Yeah, Jerry, welcome to the COC. And would you be willing to put your email in the chat box if folks want to reach out to you to collaborate?
Yes, of course. I really appreciate that.
Thanks.
Thank you, Chase. Okay, so that was Renewing Hope Strategies. Anybody else from Emmanuel Project, Riverside County Veteran Services, or United Educational Academy in the house with us today?
Yes, this is Juan Cornell from the Emmanuel Project.
Welcome. Did you want to tell us a little bit about your organization?
Sure. We are a nonprofit recuperative care provider, which is fairly new service in the Inland Empire. Basically, recuperative care is a a short-term residential care for homeless individuals who requires who no longer requires hospitalization, but still need a place to heal from their injury or illness, but basically has no place to go. And we fill in that gap by providing not only shelter, but also connecting these individuals to social services, getting them on the track to permanent housing, connecting them to income if that is lacking, life skills, mental health services, substance abuse services, and so on. We service the Riverside County, San Bernardino County as well. And 24-hour staffing. Like I said, we provide life skill training as well. So
Awesome.
Glad to be with you guys.
Thank you. I would follow with what Michelle had stated earlier, if you don't mind putting your contact info in so that if folks want to network with you and collaborate with clients, that would be fabulous. Thank you. Welcome. We're so excited to have you. Anybody else from new members before I move on to new voting members? Anybody? Okay. I'm going to move now to agenda item 1.3, which is to introduce new voting members. Now, Illumination Foundation is not new to us. I know they've been partnering with the City of Riverside, the county. So Illumination Foundation, anybody from Illumination here today? Okay, how about
Hi, everyone.
Oh, sorry. Who's with us from Illumination
Oh, it's
Foundation?
okay. Hi, everyone. My name is Caitlin. I work with the Illumination Foundation. For those of you that don't know, we are a nonprofit organization. We facilitate services in Orange County, Los Angeles, Riverside County, and San Bernardino. Specifically in the IE, we have recuperative care, medical respite, short-term post-hospital facilities, one in Riverside and one in Colton currently right now. Very similar to the last individual that shared about medical respite, same process. They get full wraparound services while they're with us. Case management, housing navigation, substance counseling. We have on-site therapy, pretty much everything they need to get their lives back in order. Also, they are referred by their managed care plan. So IEHP, Molina, Kaiser. You guys have any questions on how to get any of your clients into recuperative care or short-term post-hospital or housing navigation, please let me know and I can walk you guys through the process. I will put my email in the chat. Yeah, I'm happy to be here. Thank you.
Thank you so much. Welcome. Okay, anybody from Family Services of the Desert?
Hello, this is Tom with Family Services of the Desert.
Welcome. You want to tell us about your organization? Welcome to being a new voting member.
Thank you. We are actually under the banner of Food Now. We're part of Feeding America, located in Desert Hot Springs. And we offer food supplements to the food insecure families and individuals in the Desert Hot Springs, Palm Springs, Cathedral City, and surrounding areas. We are also launched a couple of supplemental programs. We've noted that out of our clients, both the families as well as homeless, about 2/3 of our clients have pets. And in order to solve the issue of families and individuals not giving their human supplemental food to their pets, we are offering a pet food program as well to be able to manage that and support them in that calling. And we've also indicated a need in elementary and secondary schools for children who are in food insecure families that while they may be on the meal programs through the schools, they don't always have enough to eat on weekends and breaks. So we're actually offering some supplemental meals to them as well.
That's awesome. Well, welcome all of you. You know, this is so important for all of us to continue the theme of collaboration. Sometimes it's about working together to integrate our resources. So we're not duplicating and we can stretch our resources further. So I encourage you all to continue to reach out, get to know one another. If you're serving in the same region of this large county, sometimes you guys might be serving the same clients, or if you're not, you should be. So anyways, thank you all. Keep getting the word out. We want our continuum of care as diverse and broad as possible. So this is always super exciting for me. We're going to move on to the next portion of the agenda, which is agenda item 221, consent item for approval of the September 27th, 2023 Continuum of Care minutes. Do I have a motion to approve the minutes? Anybody?
This is Angelina Nicole. I make a motion.
Thank you, my dear. And do I have a second?
This is Terry Smith. I can second.
Thank you. Do I have any abstentions or objections?
Michelle Davis from City of Riverside, I have to abstain.
Okay. Duly noted. Mara's taking minutes here, so hearing no other abstentions or objections, the item passes. Moving on to agenda item 3, public comments at this time. Members of the Continuum of Care can hear from the public to speak on any item that is not already on the agenda. You have up to 3 minutes. Marielle, have we received any written comments from the public?
No, we have not.
Thank you. Do we have anybody with us today that would like to make a verbal comment? If so, raise your hand. Okay, hearing none. We're going to move on to another favorite part of the agenda that I absolutely love, 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 and that is the leadership spotlight. We have so many amazing leaders across this county doing phenomenal things to prevent and end homelessness. And so this month, I am very pleased and honored to have with us Javier Lopez, who's the executive director of Valley Restart Shelter. And he is doing some amazing things with his team and collaborating with their public and private partners in that region of the county. So Javier, I would like to turn it over to you. We're excited to hear about what you want to tell us about all the cool things you guys are doing.
Yeah, well, thank you very much, Karen. Actually, the honor is mine to be able to present this short, give this short presentation on Valley Restart. Some of you know I've only been here for 2 years, a little over 2 years, and we've really done a lot of great changes, and not only in terms of trying to rehabilitate our campus, but also expanding our programs and trying to serve more people, because we're getting more and more inquiries on helping families get back on their feet. We've been helping families since 1989 when the organization was founded. So that means that next year we're going to be celebrating 35 years of helping our homeless families get back on, on their feet and into upper level housing. So if you can, next slide, Marielle. And by the way, thank you very much, Marielle, for doing this, because I'd be lost. So, but
No
thank you.
problem. You're welcome.
Again, founded in 1989 by a group of local churches that to provide food and clothing for the local homeless folks that were out on the street. Then the following year, it was incorporated into a 501c3 nonprofit organization. And for the first 6 years, pretty much met at members' homes, the churches, and wherever they could meet, and so on. It relocated to the our current address, 200 East Menlo Avenue here in Hemet in 1995. It's property, it's pretty large property. We're on 4.5 acres of mostly undeveloped land, which trying to see how we can develop it into some affordable housing, or as we expand our shelter space as well. And then you see there the other dates of who was here prior to Valley Restart. From 70 to 95, we had the local YMCA. Those of you that have been to our campus can still see the empty swimming pool that's there, the big old large pool that we're trying to see what we're going to do with it, cover it up or remove it, and add some housing or some administrative space or something. And then from 41, to 1970, this property housed migrant farm workers. So there's a long history of this facility being here in this location. And, over the years, it's expanded to now house Valley Restart Shelter. So next slide. So there's a lot that we've been doing in terms of trying to beautify the campus and keep up to code and whatnot. Currently have 11 rooms for families and 4 large dormitories for single women, giving us up to 49 beds at any given time. And I'm going to speak in a few minutes about this, but we also added the 6 pallet shelters, so our number of beds have increased. But we have AC and heating provided year-round for families. We provide 3 meals a day. We do background checks. Chores are required. We have curfew hours, so there are rules that need to be followed and so on. We do random room checks, random drug testing, and we do have a savings program where families are required to save up to 80% of their earnings for, future apartment or other higher level of housing that we help them obtain. So next slide, please. And this one really shows the what we have, and you can see the age of the facility that we're working with. Half of our rooms still need flooring. So we work with a lot of private donors trying to get to adopt the room or adopt the family. So we can give them a decent place to stay while they're here, because we are a short-term emergency shelter, 30 days up to and no more than 90. If they're following rules and they still need the extra time, we give them that extra time to get them back on their feet. We've worked with a lot of other partners. Some of the rooms, for example, the one on the left that you see there, we've had the youth build program at California Life Center here in Hemet. It's a vocational training program. So when they get grants to practice their hands-on training, we have over the years we've become their classroom basically, and it's become a win-win where the kids practice their hands-on and they benefit us and the residents we serve. And over the years we've added new energy efficient doors, windows. Last year we re-roofed the entire facility. We resurfaced the parking structure. Right now we're working on getting a brand new fence along Menlo Avenue with security gates and so on. So there's a lot that we're doing. It's keeping us busy, and we want to make the families feel at home and safe, when they're here. As I mentioned, Maria, you can go to the next slide. We just recently received occupancy permits for our VRS Village, which is the 6 pallet shelters for homeless seniors. They are constructed to accommodate 2 adults. And initially, the city of Hemet was only going to allow us only single occupancy. But when we went before the city council, they looked into it, and we argued that, it was for seniors. And, we had a couple, we weren't going to separate, the husband from the wife, when they could be together, it wasn't going to make sense. So they gave us the permits with no restrictions. So instead of housing 6 seniors, we can house up to 12, which is very good. And then, of course, we're working with Housing and Workforce Solutions Department, so we can add another 6 in the coming months. And these are also going to include another hygiene or shower structure, as well as a laundry facility. And these are called, I tell people, they're pallet shelters, but they're not made out of pallets. The company that makes them is called Pallet Shelter House. Mm-hmm. So that's why we call them pallet shelters. But they're, made out of steel, and they meet all city codes and you name it. So, they're all very, very nice. And the next slide will show you how they look. So they're fully functional and landscaped and so on. And you see a picture of the interior of one of them. They come with a one bed, but we were able to get donated some extra cots to make sure we can house 2 people. They all have AC and heating. They come with fire extinguishers, carbon monoxide, and fire alarms and everything else. And we provide the hygiene, the welcoming kits, of course. These don't have curtains, but the current ones already have curtains, mats, chairs, and so on. So as we continue to grow and expand, we're trying to modernize our shelter space to help our homeless folks, have a decent place to live, which is obviously way better than the streets or their own vehicles. But these past 2 years have been very busy in terms of doing community engagement. You can go to the next slide, Mariel. We've created a new website to keep our stakeholders and the community informed of what we're doing. We're expanding our presence on social media, on our social media platforms, on Facebook, Instagram, Twitter. We started a monthly newsletter to keep the community informed. And you want to read the newsletter, send me your email, or you can always go to our website and download the current edition there as well. We also published our first annual report, again, to tell people what we're doing and how we're, really using the dollars that we're getting, in terms of grants and whatnot. And we want to make sure we're spending that dollar where that dollar needs to be, right? So, and I'm constantly out there doing outreach and engagement with local organizations, because when I first started here, a lot of people had the idea that we were the ones recruiting the homeless to Hemet, and they were all thinking that all the homeless are the same, right? It's basically the guy on the street doing drugs or fentanyl or you name it. When in reality, there's families that we serve. There are children, that we serve that need to go to school, and we have partnerships with the local Hemet and San Jacinto school districts. The bus picks up the kids and drops them off. And they'll pick them up first, drop them off last, so other kids don't know that they're homeless. So which is very nice. We're trying to expand and add a computer lab on our site as well to have the kids, stay on top of their homework assignments and whatnot, and also help the families or the parents, continue their housing search and so on. So next slide. So that's what we're doing now. Of course, for future goals, we want to continue expanding, because the need is there, unfortunately. Market, you guys all know the market rate housing is very high. I mean, you drive around town, any town that's bringing in new housing, but who's the housing for, right? It's usually not for the locals. So a lot of families are being pushed out. Many are, one paycheck away from ending here with us and with you folks as well. So, we're working hard to do a lot of prevention also, because we do have we offer rapid rehousing assistance as well. So we do a lot of not only helping our current homeless residents, but also helping others that might need assistance to stay in their place. And so a lot of homeless prevention is taking place there. We're working with City and County also on hopefully some trailers to see if we can use for transitional housing as well. We're looking into multifamily developments to see, as I mentioned earlier, we're on 4.5 acres of vacant land that we want to develop. A lot of families are ready to become better tenants. We're offering credit counseling. We're offering budget, money management skills. We have the savings program, as I mentioned. So we're retraining to reintegrate a lot of these families back into society, basically is what we're doing. So, we want to make sure they're becoming better, renters, better tenants, better homeowners, hopefully in the future. I'm talking to tiny home developers. I've spoken to container home developers. What are the other? Those sectional homes, mobile home developers and so on. to see what we can do on our property as well. Thinking of putting up a boutique store also, or a gift shop, because we get a lot of donations and it helps us provide. And this is something I brought up to our county supervisor, Gutierrez, who supervises this area, because he's done a homeless to workforce program when he was mayor of Moreno Valley. So we're in discussion and partnering on trying to do some job training and workforce development. So a gift store would allow us to offer some kind of a retail training, for example. We also have our commercial kitchen, that's pretty much empty most of the daytime. So, and I mentioned that to him also, and I showed him I showed him the entire campus when he was here, and and his chief of staff was with him, and Tanya Torno was also here, gave him a tour. And that's another area we wanted to do some kind of a culinary arts training, or some kind of a food handlers licensing, or whatever the case might be. But it's just thinking outside the box, as they say, or in many cases getting rid of the box, right? And just going forward and do what we need to do to get these families back on track. So pretty much that's it. That's in a nutshell, that's basically what we're doing. Next week on November 1st, we're having our grand opening. Thank you for getting that as well. And we're going to have Supervisor Gutierrez here. We're going to have the mayor of Hemet and some of the other folks that work with us. We're turning the narrative into our favor. And it's safe to say that the political winds have kind of shifted, or continue to shift in our favor, in terms of helping the homeless population. So, one day at a time, one family at a time, and we'll get there. So, but thank you for allowing me to do this. And Mariel, cannot thank you enough for your help. So, all right.
No problem.
That's a great job, Javier.
Thank
So we're going to open it up for questions. It looks like Gina has a question.
Yes.
Thank you. Had to unmute myself. I am so happy to see everything that you've done the past couple of years. It's kind of like, for me personally, a dream come true. And I'm excited that San Jacinto and Hemet, we got some funding from the county. I was curious if you have already been integrated in the planning for that. And I have another property that could be very helpful in this situation that I think everyone should look into.
Are you talking about the encampment funding, Gina?
Yes.
I believe
Okay.
so, yes.
So, Tanya, I don't know if you wanted to address that.
Sure. So I wanted to make sure I understood the question correctly. Do you mind restating it? I'm sorry.
Okay. Just in light of the success that Valley Restart has had, I was hoping that they would be heavily involved in utilizing the upcoming funding for the homeless in the riverbed. And I mentioned that I know of a property. There happens to be right by the riverbed a property that I think would be an excellent place to start constructing and creating a proper place for people to be.
Gina, I love that you're looking at opportunities within the region. And for those of you, just to kind of bring you up to speed, and maybe those of you that weren't with us during our last meeting, we announced an award of $12 million in state funding to launch a multidisciplinary and jurisdictional response to address homelessness for residents who are in the San Jacinto riverbed. And that initiative includes resources for staffing, who will provide direct outreach and case management services to see people from street all the way into housing. And we are just beginning to have some discussions on the different types of housing resources that will be needed, and we'll actually be releasing a bid application in the next couple of weeks. We'll make sure to do an email blast to the Continuum of Care membership, so all of you should receive that announcement. But essentially, we are looking for developer providers to basically come to us with their ideas on what they could do with resources to build a new, we're thinking a navigation center that would provide some additional shelter beds. So to your question of could these resources be available to Valley Restart? Valley Restart and any other interested provider would certainly be encouraged to apply. Our plan is in the upcoming weeks, I'll end with this, to say that, and I should say in January is sort of our tentative launch date. We're still waiting for our formal agreement from the state. And once we launch, we will have regular case conferencing calls. And we'd love nothing more than to include any providers in the region that want to join and be a part of this effort. We welcome you to join us for those calls so that we can review the client by name list together and get your help in getting people connected to services. So more to come. We'll definitely be sharing more as we learn and implement the program.
And can I throw out the property that I am talking about? There's the San Jacinto River Park, which has lain fallow for quite some time. It's 52 acres right along the river. It's not impinging on any schools or anything. I happen to live in the mobile home park, senior park that's closest to that property. I hope that and I believe it's actually officially county property. I've mentioned it to a few other people. I just keep forgetting to connect and reconnect. So every opportunity like this one, I'm trying to throw that out so that you can start investigating. It's under the valley-wide control park system, and again, it hasn't been used for a long time. At one point, it had water, it has electricity, and a lot of space. And if you're talking about a whole complex, this would be an ideal place to put it, I think. And there's bus routes. So
super. That's good to know.
All great feedback. Thank you. Javier,
Yes.
a great presentation. I had two questions. If I missed it, please forgive me. For the pallet shelters for the seniors, what's the maximum length of stay? That's the first question. And the second question is, I'm curious to know where most of your operational funding is coming from. I think it's good educational for other people that are on to know those details.
Yeah, that was one of the questions that the city council had asked, because when we were working with them, the program has not changed. It's still 30 days up to no more than 90. So and a lot of these folks are already seeking housing or waiting for an apartment themselves. So we want to continue that as well. So a lot of the and then what was your question on operations?
Yeah, the primary is it multiple funding sources?
It's multiple funding sources. Yes.
Okay, so probably public and private, so some grants.
A combination,
along with...
yes. Grants, and we get a lot of donors and so on.
Great. Well, I'm excited to see you guys focusing on seniors. There's this age tsunami that is upon us, and I think all of us across the region that are involved in sheltering and housing, we see a trend of so many folks that are seniors that are in very difficult situations at a time of life where you wouldn't want to be dealing with that. So kudos to you guys for doing that. Really happy to see that happen. Yes. Okay. Any other questions or comments for Javier? Gina?
Thought you mentioned about up to 90 days. I know there are some rare exceptions, but is there any way to adjust the program? Because if you think about it, even with your savings program, how much money can they save in 3 months? And with the price of housing, astronomical,
Right.
they're going to need just more time to earn more money to set aside to actually make the transition. But I know that's kind of a general format that most shelters have, up to 90 days.
No, we're looking, and we are looking at that being a new program for seniors. So yes, we are going to look at that and do it on a case by case also. But for the most part, we've been very successful in getting people out within the 30 to 90 day period. One thing I also want to mention is that I have one of the local Catholic churches, the priest here has committed to help us with more pallet housing in the past. And he also gave me a tour because he has retirement homes in one of the local churches in the back for retired priests. And there's only one retired priest, and he's got like 10 rooms available in 2 large buildings that he's willing to work with us hopefully in the near future for transitional housing for seniors as well. So, it's
That's
those
awesome.
relationships that we've been building in the past few months to get going, on a lot of these opportunities that are out there, because those buildings, he gave me a tour. They're very nice, and yeah, they need a few areas that, maybe a broken window or something, but nothing major that we can use for transitional housing for seniors and others, or even young couples that might be homeless. Mm-hmm.
That's exciting. And we're seeing a
Mhm.
trend of faith organizations that have land
Yes.
that are looking to partner. Congratulations, Javier.
Mhm.
That's really entrepreneurial and public-private partnering, so that it's not all your eggs in one basket with funding
Right.
and resources is phenomenal. So we're excited to see this roll out, and we'll be sending good thoughts your way and hopes that
Thank you.
comes to reality for you.
Awesome. Thanks. Thank you very much.
Okay. Oh, Ayako, did you have a question of Javier?
Yes, Javier, thank you for your presentation. Yes, you mentioned trailers that you were working with the city and the county. Have you already acquired these and are they RV trailers?
No, we have not acquired them at the moment. We're still awaiting because one of the requirements is the county wants us to make sure that the city is okay with us having the trailer. So we're working on getting a letter of support from them at the moment. So yes, but they're
Okay.
aware. I mean, the city manager is very much aware, and so are the electeds. Mhm.
Okay.
Greg, the trailers are travel trailers. They're in the possession of the county. So we're just, to Javier's point, just waiting on okay from the city.
Oh, okay. It's the ones that you
Yes.
have already. Okay, great.
Yeah, we're allocated them through FEMA. So
Got it.
Nice. Okay, great. Thank you. Okay, are we any other questions? Javier, good job. Thanks for all the great work and for your presentation. We'll go
Thank you.
ahead and move on to the next segment of the agenda, new business. And we're going to go to agenda item 5.1. And this is the Medi-Cal renewal process. Excited to hear this presentation. Riley, a home-based presenter, would you like to go ahead and take the floor? We're excited to hear from you.
Thanks so much. Thanks for having me here, and thank you for sharing the slides. That's always a nice surprise when I don't have to do it myself. But I'll be putting some things in the chat as I go along through the presentation. But hello, everyone. I'm Riley Meeb. I'm from Homebase. Homebase is a nonprofit that helps communities across the country for the past 30 years address homelessness and its root causes. We have a lot of experience working with California communities and also helping those communities address the intersection between the homeless response system and healthcare. And I'm here to talk to you today about Medi-Cal renewals and how you can ensure people experiencing homelessness retain their Medi-Cal coverage. And Homebase, we've started this campaign, but it's like a team. It's a small team of us, so we've been going to COCs across the state, and we need Riverside COC to help us spread the word about this campaign and help people experiencing homelessness renew their Medi-Cal. This is about, I think, like our 4th presentation with Riverside. We've gone to some other committee meetings. And so for some of you may have heard this presentation multiple times. You may have joined some of our statewide webinar. and you maybe have looked at our website and seen our toolkit already, or maybe this information is totally new to you. So I'm going to keep that in mind as I speak today. Next slide. So this slide we generally use to alert communities about our campaign, but today I'm kind of using it as an agenda. So from this presentation, you're going to learn how Medi-Cal renewals have restarted, how millions of eligible members are expected to lose coverage, and people experiencing homelessness may be at more risk for that. Today's presentation is only like 15 minutes, and so I can't cover all the in-depth information I want to, but I do hope to have some time for Q&A, and I also hope that after this presentation, if this topic applies to you, you check out our toolkit in our website with a lot more information. And I'm going to provide the link to the toolkit and talk more about it at the end of the presentation, but it's a super in-depth guide for how to help someone renew Medi-Cal based on, if you're a provider, if you yourself are someone experiencing homelessness, or your health enrollment navigator. Next slide. So just so we're all on the same page, Medicaid is a public health insurance program that was created to cover the healthcare cost of low-income households and people with disabilities. And every state runs its own Medicaid program, and Medi-Cal is California's state version of Medicaid. It serves almost 16 million people, and it's more expansive than other state programs. So it makes it more of a vital, service for people in California. Many people experiencing homelessness are eligible for Medi-Cal and are already currently enrolled in the program. And Medi-Cal provides access not only to healthcare services, but now it provides access to housing-related services under the CalAIM initiative. And this is an initiative to improve the health of residents of California with the most complex needs, including people experiencing homelessness. And the two main components that you can look into more on your own time are enhanced care management and community supports. So now I'm going to talk about exactly what Medi-Cal renewal means, what the process is, and why there are certain barriers for people experiencing homelessness. So this slide is really the heart of our campaign, what led Homebase to start this project. We want to address that renewal notices are coming in the mail, but not everyone has a mailing address. So Medi-Cal enrollees must renew their coverage annually, and renewal is just basically you're going to your county and showing them you're still eligible to continue receiving benefits, and this is different from enrolling. It's when you're already enrolled. And for the past 3 years, Medi-Cal members, though, have not been required to go through the renewal process because of the pandemic. It's been called like the continuous coverage. And now, though, renewals have restarted as of June 2023. And renewal packages are being sent in regular mail, in yellow envelopes to the last known addresses of members. And everyone has different renewal deadlines. These are based on the anniversary of someone's Medi-Cal enrollment or the anniversary of the last time they renewed. So renewals are going to be ongoing, for the next few months. And it's a year-long process. And once someone's renewal packet is released and mailed, members have a 90-day window to submit their renewal packet. Luckily, after that deadline, there is a cure period. So it's if you have another extra 90 days in case. Sometimes when people submit renewals, the state will ask for follow-up information. So on this slide, there's some statistics about estimates of how many people are going to lose coverage, and it's predicted 250,000 eligible Medi-Cal members are going to lose their coverage, not because they're no longer eligible, but because they made an error on the renewal packet. Maybe they never received the renewal packet in the first place, so they didn't know they had to renew. And this could really happen to anyone. And luckily, the Department of Healthcare Services has seen these numbers and they don't want this estimate to come true, and the agency has been developing flexibilities to make it less burdensome to be renewed, and I'll talk more about that, but just given how many people, the unprecedented 3-year pause, and given how many people are Medi-Cal, some people are going to slip through the cracks unless advocacy like this happens. If people don't renew, what does happen is they lose their Medi-Cal health coverage and any Cal-AIM housing supports they were receiving. And, you know, if you do lose your Medi-Cal because of a failure to renew, you can still reapply. So it's good to know that there is that option, but it's not ideal because, you know, cycling on and off Medi-Cal can lead to disruptions in care and poor health outcomes. Next slide. So people experiencing homelessness are more at risk of not knowing they have to renew and therefore losing coverage because, as I mentioned, Medi-Cal renewal notices are sent in the mail to last known addresses of members. If someone lost their housing and hasn't, or they haven't updated their mailing address on record, you know, they're not going to receive their renewal packet. And for this reason, renewals are something we really want everyone part of the homeless response system to know about and, you know, help their clients with. Next slide. Luckily, you know, renewals aren't new. As I mentioned, this is something that happens yearly. There was just an unprecedented pause because of the pandemic. But California has been trying to implement some new flexibilities this year that are going to hopefully simplify the renewal process for people experiencing homelessness. So first, if an individual is very low income, in other words, or that's defined as being at 100% of the federal poverty line or below, those individuals should be getting automatically renewed. And it's called, this process is called ex parte. So if you're at 100% federal poverty line or below, you know, you shouldn't be sent your renewal packet in the first place. You're just going to get a notice that you were auto renewed and don't have to do anything. And this is a huge victory for people experiencing homelessness because, you know, we expect that many people are going to fall under this category. However, it's still really crucial for providers to help their clients determine if they still need to complete a renewal. Some people experiencing homelessness may still be required to do a renewal packet if the state doesn't have updated income information, or the individual maybe has had a really recent change in drop in income. And also, it's important to keep in mind this automation is a really great step, but it's also really new. And in this first year of these automatic renewals, I think it's really important to double check to make sure people's healthcare coverage is active. Now I'll share one slide back, sorry. I'll share the federal poverty guidelines in the chat. And there's a second special rule that's important to know about for your COC. It's that if a county knows an individual is experiencing homelessness, expedited renewal or re-enrollment may occur. So counties, in order to trigger this special rule, counties are relying on individuals themselves to declare their homelessness status. And I'm going to explain in like 2 slides how exactly someone can do that. But if a county knows a member is experiencing houselessness, you know, they can renew them, but that renewal only lasts for a year. The same goes for auto renewals. And this is a reminder that the renewal process repeats itself annually. So we're paying attention to renewals now a lot because of the unprecedented 3-year pause, but renewals have been and always will be critically affecting unhoused populations if renewal notices continue to be sent in mail. And one other thing I want to point out, these special rules were set by the state, but they're implemented at the county level, meaning there could be differences county to county. So part of our campaign is to, you know, develop a relationship with COCs and be able to get feedback from you all about how renewals have been going and how interactions with your county Medi-Cal office are. Next slide. So now I'm going to talk about kind of what is in our toolkit a bit. I'm just scratching the surface, as I've said before, but It'll give you a sneak peek at how you can help. So there are strategies for helping people experiencing homelessness renew. The 4 general ways that the state allows people to renew is by mail, online, by phone, or by visiting the county Medi-Cal office. And so these are all options available to individuals experiencing homelessness too. It just is going to look a little different. The most important thing first to do is having individuals, maybe your clients, update their contact information on record with Medi-Cal, especially updating the mailing address if possible. In the communities we've spoken to, homeless providers already are or planning to offer up their mailing address to clients for Medi-Cal purposes. And that way, clients can receive information on time for their Medi-Cal renewal packets or maybe for receiving auto renew notices. And then the way to update contact information is by either making an online account or contacting the county Medi-Cal office. So for an online account, any individual with Medi-Cal can make one on benefitscal.com. All you need to do to make an online account is make an email address. So recognizing that not everyone maybe has an email address to start with. But once you do make that account, within an hour of signing up, the actual renewal deadline should show up on the person's account. Sometimes it's on the weekend. That information might take a few days to load till the weekday. So you can update your contact information there. You can see when a renewal deadline is. And then once that renewal deadline comes up, you can actually do the renewal. If you're not auto-renewed, you can help an individual complete their renewal online. But individuals, going online isn't the best for everyone. So you can also contact the county Medi-Cal office by going in person or calling to update contact information. And one other benefit, though, of contacting the county office is, they can trigger that second special rule I was discussing, that if an individual declares themselves as homeless, the county can help expedite the renewal process. And it's important in general for that county to have that information. If a client wants to renew by contacting the county office, providers can help by traveling with the client to the office or calling the office while the client is physically present with them. I think in another Riverside community meeting, we heard 3-way calls don't work, like doing a conference call. You'll get booted out of the system. But sometimes it seems easy to go straight to the source for the Medi-Cal accounting office, but also there can also be lots of long wait times on the phone and in person, because these offices do more than just handle renewals for Medi-Cal. So basically everything that I just mentioned is outlined in more detail in our toolkit. I see in the chat that no 3-way calls. Yeah, this is something we heard in another Riverside community meeting. I could be wrong, but when you call I'll give the number to the county Medi-Cal office in a slide or two. But this is just some information we've heard, which it does suck because you don't have to physically be with the client. So I put the Homebase website where the toolkit lives in the chat, and it's going to explain everything I just talked about in much better detail. And it also breaks the toolkit down by audiences. So you can learn about this as a provider. You can also learn about this as a person experiencing homelessness yourself who needs to renew, or also as a health enrollment navigator. Now, if you've seen our presentations before, you might have noticed some things have changed because like I talked about the 100% federal poverty line or below new rule, that wasn't a thing until it wasn't implemented till the end of September. We started this campaign in July. We're staying on top of changes that are happening, and our website is a great place to go to learn about those updates and changes. If something significant happens, we change the toolkit as well. So our materials are dynamic. Next slide. So for your COC, here are some important contacts. I have on the slide the County Medical Office for Riverside, which is the Department of Public Social Services. I have the phone number. Some of you might know, sometimes there are multiple phone numbers, and the Department of Healthcare Services, where I pull this information, doesn't always have the best information. So some of you may know better ways to contact the office and would love to hear if anyone has any suggestions about that. And then I've mentioned health enrollment navigators. So these are organizations that provide free services to individuals, and they're trained to help hard to reach populations with Medi-Cal enrollments and renewals. So these are great resources in your county to collaborate with them. And especially if you're a provider that feels kind of like stretched in terms of capacity, these could be great resources to lean on if you're struggling to help your clients renew, or you just have really specific Medi-Cal renewal questions. And in the chat, I'm going to put the link to your county Medi-Cal office and the list, or the yes, sorry. And then also this information should be in the slide deck you receive. All right, so next slide. So this is my last slide here. Just want to reiterate again, check out our toolkit. If you have any questions at any time, you can contact Medi-Cal at CCC at homebase, or Medi-Cal at homebaseccc.org. I got ahead of myself. And we also, you can email us to provide feedback. Tell us your stories about how helping people experiencing homelessness complete renewals is going. We have developed over this campaign a close partnership with the Department of Healthcare Services. And the more stories you tell us about what is going well, we can help advocate for a better renewal process for individuals in the future. So no amount of feedback is insignificant. Another space to ask questions and provide feedback is our office hours, and I'm going to share a link in the chat to office hours. It's occurring on November 16th at, I think it's 11 to 12. Anyone can join. And if you want to receive direct information from Homebase about this campaign, information about when office hours are coming up, updates to our toolkit, just policy updates from the state, please, please, please sign up to the mailing list. On the bottom link I just shared, it's a Google form, and we'll add your name to our email listserv. And it'll be much easier to get information this way if you kind of lose track of our web page. And I think that's all. There's a question in the chat. Should we use a tablet when helping to sign someone up or renew their Medi-Cal, or should we use the phone instead, which is easier? By phone, do you mean like using the online account on phone, James, or like calling?
Calling.
Yeah, that's a great question. It kind of just depends on maybe the person you're helping, their situation, what they're comfortable with. With a tablet, there aren't any wait times, but you do have to, the person has to have an email address to make an account. So you might need to help them set up an email address. The phone, sometimes phone is easier. I prefer to call a lot of times, but you might call and there might be a long wait time. So you might just have to assess the situation then and there and see what your client is more comfortable with.
Thank you. That was very helpful.
Of course. So does anyone have any questions or feedback they want to provide? I see Greg has their hand raised.
Yeah, great presentation. I just want to let the members of COC know that the county has been very aggressive, actually, in conjunction with both our health plans, Inland Empire Health Plan and Molina, on renewals. And we've been doing that for months. Additionally, outside of DPSS, all of our community health centers, so 14 of them in the county, can renew through for Medi-Cal renewals. So when a lot of our homeless individuals visit those clinics and have that access. So we've taken aggressive efforts, but any further outreach that the providers can do, and I know we let you all know about this a few months ago through email and I think a discussion on this call. But again, great presentations. Thank you.
Thank you. That is great to hear. That's information that I can't provide. So we hope with these presentations that we're encouraging conversation within the community about, you know, what's going on, how to take advantage of, you know, efforts already being made by the county, for example.
Madam Chair, you are on mute.
Yep, sorry about that. I was just gonna say, I don't know if this is more of a Greg question than a Riley question. I'm assuming that they're following through data reports. If there are folks that that have expired and there needs to be like if there's a high concentration and the trends in terms of how we are with accomplishing that for the renewals, or if we've got some lagging. Do you know if that's, I'm sure it's going on, yes?
Yes.
Yes, and we're doing okay?
Yes.
Okay, thank you.
Oh, one thing I
So,
can add to Karen, there is a data dashboard the state has. I can go find the link, put it in the chat, and you can search that information by county. They update it monthly.
oh,
And
that's good.
yeah, so by December, because renewals people have 90 days to complete, sometimes there's a lag in showing results. By December, they're hoping to see more of a really positive impact from the auto renewals, because that was just kind of started in October.
Does anybody else have any other questions or comments? You have the toolkit at your disposal, so lots of resources that you can make available to your staff and the clients. So really great presentation. Thank you so much for giving us all this great information. We really appreciate it.
Karen, I have one last question. This is Carol from Faith in Action.
Sure, go ahead, Carol.
Could you repeat again where we should go to check the status of someone's Medi-Cal status? In other words, are they up for renewal, or what's their renewal date, or, you know, are they completely delinquent? I think you mentioned that earlier, but I just wanted to go back and clarify that.
Yeah, I mentioned it briefly. I didn't talk about it as its own subject, so I'm glad you raised that. Probably the easiest way to know that is through an individual's online account. It can tell you if their Medi-Cal is active, if they're up for renewal, or if, you know, they missed their deadline, Medi-Cal isn't active anymore. You can also get that information by calling the county Medi-Cal office and being connected to the case manager. They can give you that information as well. I think if you have a CBO account through Medi-Cal, you can't see when you can only see when someone is up for renewal when they're in their renewal period, which is a little inconvenient. But I think the state is aware of that, and maybe some changes will come with that. But through the CBO account, you know, you can see when renewal is up.
Is that available through Benefits Cal website?
Yes.
Okay.
I don't know the exact requirements for requesting a CBO account. If you're like a community-based organization that needs access to Medi-Cal information, I'm not aware of the whole process for how to request that. We've just heard through presentations.
Right.
That's how some providers are
Right.
staying
We
on top
we
of
use
their
the
clients.
Benefits Cal website, and you're a lot through that website. You can have access to a lot of these social service programs, getting people enrolled them in a one-shot deal. So I just wanted to make sure that Medi-Cal was part of that Benefits Cal website.
It is, yeah.
Thank you.
So I clicked on the dashboard and I see that it shows Riverside's county's total enrollment as 1 million. Do you know if that means people that have already been renewed, or do you know what that means?
Let me look at the link. It has the dashboard has a lot of information.
Yeah.
It's the total number enrolled in Medi-Cal in Riverside County at the current moment.
At the current moment, including
It would be anyone that has renewed, yeah.
okay.
And that's about the right number of Medi-Cal patients we have in the county. It's about half of our population, a little under.
Cool. Okay. Anybody else? Any other questions or comments? Okay, thank you so much, Riley. Appreciate it.
Thank you.
Appreciate the partnership. Okay, we are going to move on to the next agenda item 5.2. And Marielle is going to walk us through the proposed 2024 meeting calendar. We're not taking action on it today. I believe she's just presenting it. And I think we'll take action the next meeting. Is that right?
Yes, that's correct, Madam Chair.
Okay.
Thank you.
Go right ahead.
Thank you. So here are the dates that are proposed for the next calendar year, and I'm realizing this says 2023. Apologize. I'll be sure to correct that typo. For the 2024 calendar, this is based off of how we've met this year. It'll be every third Wednesday of the month, except for I believe November and December, where we want to avoid those holiday dates. So at the next meeting, we'll be having a vote. I'm sure we can either do a Google form or just do it the way that we normally do with approving a motion. So just wanted to make sure this is on everyone's radar so you can check if it works with your calendars. If not, feel free to email at coc@rivco if you'd like to propose other dates or different meeting times.
Marielle, are we moving back to 2 o'clock?
Yeah.
Or is it staying 3 to 5?
We can keep it 3 to 5. I believe this might have been based off the old template. I apologize.
No worries. I just wanted to make sure. We're going to keep it 3 to 5. Is that right?
Yes, we can keep it 3 to 5.
Okay. Any questions or comments, everybody? You may recall we all agreed a while ago. We felt like there was a lot of important business strategically to stay focused on. So we meet every month except for the month of January. So just one dark month. Okay. Gina, were you trying to say something, or are you giving us the thumbs up? You're on mute, my dear. Oh, you're still on mute. Okay. Okay. Well, we will go ahead. If there's no other questions or comments regarding the calendar, we know that that'll be back before us for final approval at the next Continuum of Care meeting, which, by the way, the next Continuum of Care meeting, I'll just say we're going to have an opportunity for an in-person Continuum of Care meeting. I believe it's November 15th. Isn't that right, Tanya? I believe that's what we agreed upon, November 15th. And the city of Corona is hosting for our Continuum of Care meeting to have an early dinner for all of you guys and have the Continuum of Care meeting. And we hope that as many of you that can come will come, but we'll make sure that we have it set up so that if you can't, you can still participate remotely. But it's really great to see everybody face to face if you have the opportunity. I know Tanya and her team today convened our Continuum of Care directors and funded agencies today, and it was really great to be able to see everybody in person. So mark your calendars. We will be sending out a flyer, and we will ask for an RSVP to get a head count so we can figure out how much food to order. But it is absolutely our privilege to host it and be with as many of you as possible face to face next month, as we kick off the holidays, starting in the month of November for the Thanksgiving holiday. So anyways, just wanted to make that little plug for you guys to mark your calendars. Moving on, agenda item 5.3. You know, we recently received that exciting YDHP grant, and with that comes some new rules that that the staff are looking at. So we were going to propose some governance charter revisions today, but the staff is really on top of things, making sure with all of our funding sources that we look at some of the requirements for Board of Governance composition. So the staff will be coming back to you with proposed charter revisions at a future Continuum of Care meeting. So we are continuing this item. So instead, what I'd love to do is take this opportunity. Many of you already know Mike Walsh. He's been at HWS as the amazing superstar overseeing all of the affordable housing production. And he has a new role now with HWS. So Mike, did you want to say a few words?
I really didn't want to say a few words, but anything for you, Karen. Mike Walsh. Yeah, I'm the new assistant director. I'm the new Carrie Harmon. So I was joking earlier. I have an appointment for a perm and hair dye scheduled to get that red hair here in the office. But I really appreciate all the work that everyone does here. We were joking earlier about the post-traumatic stress that comes with receiving Continuum of Care grants there, and I bear some of that PTSD as well. So if you ever have any trouble in terms of compliance things or struggling with those sort of things, know that I'm here. I feel your pain, and happy to try and make it as painless as possible, so you are all able to do the great work that you guys can. Really, we were mentioning it earlier today, that so much of it is we're expanding out like all of the other barriers for why people are homeless and come like down below. But the real like root of it is because like folks like don't have enough money and the rent's too damn high. And so how we can do to expand the supply of affordable housing, how we can make better connections so that you are all more successful in that work. And I love the presentation on how we can make better connections between health and housing earlier. So really happy to continue working with you all in this new role. And again, like I'm here to, I feel your pain, and happy to figure out ways to alleviate it as much as I can.
That's a great choice, Mike. I know that you're going to do an amazing job, as you always do. So sorry to put you on the spot, but super excited about the selection, and super excited for Juan. If those of you that have worked on housing development opportunities throughout the region, he's been a great leader working with Mike, and I think he's going to be doing a lot of exciting things now too. Is that right? More than what he already did.
No, it's as when one door opens up another opportunity for someone else. So Juan Garcia will be our new deputy director over community housing development. So many of you already know how to get a hold of Juan. So continue to get a hold of Juan, and we're going to continue to do great things as a county to spur more affordable housing throughout the space.
Awesome. Thank you for being so gracious, Mike. I totally appreciate it. You're a good sport. Okay, we're going to move on to the next matter of business, agenda item 6. Standing items. We'll start with 6.1. And I believe we have the illustrious Monique with us to give us a report. Monique, the floor is yours.
Thank you, Madam Chair. Hi, everyone. My name is Monique Rodriguez-Torres. I am the Administrative Services Manager for the HOPE program, and I oversee our coordinated entry system. And our staff, we are the lead CES agency. And this is our CES lead update. Next slide. And I hope everybody can hear me and can see me. I might turn my camera off because it is freezing for me a little bit. Thank you so much. So for our coordinated entry system, we did have 53 housing placements in the month of September. We had 1,689 calls for the month of September, down from August where there was 2,019. I like to see that our assessments are at 907 and our community queue is also at 907. So that means that everybody who has had an assessment is in our community queue and ready for housing placements. So thank you to everybody for that, for all the hard work and making sure to get those your consumers over to the community queue. For the last couple of months, I've actually had my staff starting to do tallies for the calls that we received. And the breakdown is to the right. So we had 16.37% of the calls were from literally homeless individuals. 5% were literally homeless families. 0.4% was literally homeless TAY youth. 65 plus literally homeless was 0.95%. We had 10.8% at-risk individuals. At-risk families was at 6%. And so on. I won't read all of them so that way you guys can see them. Some of the observations that I did have was that approximately 23% of our calls were from literally homeless individuals and or families. But 20% of our calls were for at-risk. And 31% of our calls were those requesting rental assistance and or motel vouchers. So that tells me that diversion and preventative measures funding for that is desperately needed. A lot of our calls that come in are from people who are not yet homeless. And we can help them before they come homeless if we just had the funding and the services available for that. So to concentrate a little bit more on preventative as well. So those were just some of the observations that we had for this past month for the calls that came in. Next slide. My camera, see if that helps. Are we on? Let's see. Are we on the areas of improvement slide? Because my slide is still saying coordinated entry update.
Yes,
there
we
we
are.
go. Perfect. Thank you. All righty. So some areas of improvement that we found. We did have our amazing Recovery Happens event this past month or this past week. And during that Recovery Happens event, we did have a booth for Home Connect. And consumers did come up to the booth and state that a lot of the referrals that were being sent out had not been contacted by their outreach team members. And we do like to have that expectation of our outreach referrals being contacted at a maximum within 3 business days. So we definitely don't want anybody that is literally homeless waiting any longer than that for outreach. So as a solution for that, what I'm hoping to do is I'm going to have our CES staff will be running reports to identify clients who have not been contacted or at least enrolled in a program, in an outreach program, along with identifying those outreach referrals that were sent out. So that way we can identify the gaps and connecting consumers to the resources. So making sure that the referrals are getting to those agencies and those agencies are outreaching those clients. Another area of improvement we saw where street outreach agencies' presence in certain cities is not as widespread. Some of the cities that needed additional attention that we can see from referrals is Moreno Valley, Lake Elsinore, and a few other of the cities in District 2. So identifying agencies to fill this service gap is going to be one of our goals as well. And another area of improvement that we found was connecting permanent supportive housing clients to clinics before, during, and after the housing opportunity phases. So what we're seeing is that a lot of our consumers, when they are when they have that home connection and when they are placed and housed, if they don't have that connection to a clinic already, or if they're not getting connected to that clinic immediately upon entering housing, the likelihood of successful housing is not likely. So making sure that we're training our case managers and our outreach workers to really make sure that they're connected to wraparound services and stay connected to wraparound services while they're placed, so that way they can have a successful housing opportunity. clients are more successful in PSH when they have access to and utilize wraparound services. Case managers know that their clients the best, so making sure that also once they're housed, that they stay involved and stay informed. You know, if you're housing a client, give that property manager your contact information. Maybe that property manager is experiencing something with them that you might have some knowledge, and if they have access to you and they can call you, I'm just saying, hey, you know, this person is having this type of an issue where they're behaving in this manner. Like, do you have any suggestions for me? Just being open and available to on-site case managers as well as property managers. Next slide, please. Thank you, Marielle. Some announcements that we have. So our Oasis Senior Vias, the 55 plus project-based voucher permanent supportive housing, they are experiencing some delays. So previously scheduled, they were supposed to schedule in early October. This project is now slated to open in late October, which more than likely at this point is going to be November because we are already in late November. So more than likely, or I'm sorry, late October. So more than likely this project will hopefully, fingers crossed, open up in November. Vista de la Sierra is another project-based voucher, permanent supportive housing. They've also experienced some delays. They are looking for an early November start, or I'm sorry, early December or late December start. I'm sorry, they were scheduled for an early November. At this point, they will be opening hopefully in late. And Rancho Las Bolsas is another project-based voucher permanent supportive housing. They are on track to open in February of 2024. So I wanted to thank, we want to thank, the CES wants to thank all agencies who work so diligently to get their consumers document ready. We can't make these housing connections without you. So we are so very, very grateful to you and for all of the hard work that you guys do. CES partnership meeting updates. So we are excited to announce that we have begun phasing in our case conferencing. So we developed a CES case conferencing request form, which has been sent out to all of our participants with our most recent meeting minutes. We did our first case conferencing scenario this past Tuesday, and I look forward to refining that process definitely and getting all of the feedback from everybody who was in that meeting with us to see how we can be better and how we can help our people and how we can house more people quicker. And then, as always, call for presenters. We're always looking for resources to get out to the community and to our agencies and helping each other out. So any program or agency presenters, if you guys have anybody in mind, or if you would like to present to our CES partnership meeting, please reach out to us, let us know. You can email us at homeconnect@ruhealth.org, and we will gladly schedule you with a presentation date. Next slide.
Hi, Monique. That was
And that's all we have
we
today.
Perfect.
That's all we have to say. So any questions for me?
So I wanted to compliment you, Monique. I know this meeting and even the last meeting when you had John presenting for you. Just want to compliment you guys for doing such a great job to move the needle, to really give us a picture of how the system is performing. It's really super helpful, and I hope that you will continue that trend. And also, you know, to let us know how, if you know, experiencing challenges, what we could do. Sometimes I know it's an end user thing, right? Because you're relying on people to input data. So how we can be more helpful to you, please continue to give us feedback. I also wanted to ask you a dumb question for the benefit of the whole group. I know you have this in the system, but I think it'd be good for people to know when you're looking at how people are being input into coordinated entry, are you using zip codes to distinguish between unincorporated areas and actual city boundary areas? Because a lot of times people will show up with a city, but it's not actually city, it's unincorporated area. So are you guys tracking that by zip code to make those determinations and looking at data?
Yes, so we do use city or a combination of the cities and the zip codes. And right now I am trying to identify a better process, especially for our outreach workers and what cities and zip codes that are tied to those outreach agencies, and have that information input into Clarity. So that way our Home Connect staff, when they're sending out referrals, they're sending the proper referrals to the proper agencies, making sure that that is an area that they do cover.
Okay. And I know, Tanya, we do the same thing for the pit, right? So the zip codes give us a good distinction between incorporated and unincorporated areas for allocation of resources and needs.
We absolutely do, right on point.
Okay. Looks like
Thank you so much, Madam Chair. I definitely thank you all for your support and your guidance, and we definitely will be reaching out for sure.
Thank you. Good job again. Looks like James has a question for you, Monique, or a comment.
Yes. I'm all ears.
Yes, I have a question. I wanted to know for my nonprofit that I founded, Inland Compassion, we're going to be doing homeless outreach in Moreno Valley. How would I be able to be a part of Home Connect? So if you guys have any referrals, we can go out and meet with them.
Oh, absolutely. So that would be, we would get you connected with HMIS, so that way we can enter you as a project. Emma or Tanya, can you speak a little bit to that about the back end process of that?
Yes, happy to do that. So we can work with you, as Monique said, to identify, well, one, to learn more information about your project, how many street outreach teams you have, and how frequently you go out into the field. And through that, we'll help you set up a project in our homeless management information system. That is a database where we track client enrollments, and we can then, I think the bigger piece is plugging you into a network that we have with all the street outreach teams who meet on a regular basis to coordinate services across the county. And those teams will include county teams, but they also include other nonprofit teams, as well as street medicine teams that we're in the process of onboarding. So we'll get you connected. We definitely need more help. So I'm glad to hear that you're able to kind of fill some gaps that we currently have in those regions. And Monique, I was going to share with you on our side, both Gina Morosco and Amy Primrose help coordinate and the street outreach services, and they're working regularly with those teams. So I'll make sure to pass on the service gaps that you identified so that we can work with our existing teams and existing to homeless compassion group to make sure that we have full coverage. And again, we're going to have more help with the street medicine teams coming on board in the next couple of weeks.
Wonderful. Thank you, Tanya.
Okay, Ayako?
Yes, thank you for your presentation. Yes, I wanted to know if CES, if you collect health acuity level in your intake, activities of daily living status, do you record that information?
In case management notes, sometimes that can be noted. Yes, it's definitely a goal. But upon intake for Home Connect, we do not. We just find out pretty basic information, and then the outreach teams will go in and enter any more specifics once they're linked.
Can I add on to that, Aoki, as we're getting ready to start a integrated service delivery pilot program with the senior population, especially those tied to disability and to increase income. But in that process, we're going to be implementing what's called a whole person health score that's being utilized in other agencies within the county. And basically that identifies the social determinants of health. So it gets to a curative health status, both physical health and behavioral health, as well as living conditions, income, etc. So.
That's wonderful to hear. That's amazing. And are you using a specific software or a specific tool?
It's a tool that was developed by Dr. Leong, who's our Director of Public Health. So.
Okay, great. Thank you.
And we'll eventually, hopefully, scale it up so that as we do intakes for, HMIS VI spit adding, is that will be part of that as well.
Great.
Very exciting stuff. And Ayako,
Very
thanks for all
exciting.
that you do in the policy world on older adults. Really, really, we can't thank you enough. So you play a critical role. We love it. And exciting system stuff, Greg. Wow, that's like super exciting. You sound like you're having a great time with this integration project. Okay, did you want to say something, Tanya?
Well, one, definitely agree with you on Greg, but I was also going to take advantage of the compliment you gave to Yoko to say truly, everyone should know Ayako is a huge champion for Riverside County and really making sure that we have a voice at all levels. She advocated for us to have a seat at a state conference last month that featured a really good discussion on senior homelessness. Not only did we have a seat at the conference, but we were able to, I was able to be a part of the panel and speak on all the good work that is happening here locally. So thank you, Ayako. I know like you had to really like twist some arms to get us in there.
It was absolutely my pleasure. It worked out. The timing just worked out so well. And Tanya did a fantastic job of very succinctly sharing the very innovative key strategies you're implementing here in Riverside County, and it deserved to be heard by the entire state of California. We need to continue to share these ideas so that we can all lift up the whole entire system so that all our vulnerable can be lifted up as well. Thank you.
And the one thing I think that was very powerful at that event, because I had the opportunity to also be there, was although they were talking about all aspects of aging, how often the issue of senior homelessness came up again and again and again. So it's just very timely in many different respects. So it was really awesome. And
Thank
for
you.
Riverside to have such a loud voice, because we were there with San Bernardino too, right?
Yes, and Health and Human Secretaries, Dr. Mark Galley was there, and so he is having an eye on that discussion, and we'll be able to see more directly what's the good work in Riverside County. So excited about that exposure.
Awesome. Great. Anybody else? Any other comments? Michelle, did you have something?
Yeah, just a quick comment on the screen for the announcement for the Oasis Senior Villas. They still have some vacancies for the veteran senior units that are for 55 plus. So I couldn't for some reason attach the flyer in the chat box, but I'll put the phone number of the property manager and their email address if you want to reach out to them, if you have a client.
Great. Our housing is excellent. Okay, looks like Robin Bishop.
Good afternoon. This is Robin Bishop from Riverside County Public Health. In the chat, I've placed 2 links so that you can familiarize yourself with the whole person health score that was created by the RUHS system, because I know there was a lot of questions about that, how we're incorporating that into our different assessments to really get a clear picture of those social drivers and how they impact our health. So please feel free to reach out to me if you need additional information.
Wonderful. Thank you.
Robin, this is Emma with the Continuum of Care. Do you happen to have the QR code or the link to actually be able to look at the whole person health assessment?
I do not at this time. I will work on that. I'm actually on my way to the airport, and we'll see if I can find something for you. But at least those 2 articles have some really good information as to how it was devised. One was put together by the CDC about creating this piece, and I'll see what I can get for you.
Yeah, I just mentioned it because we shared it with another group recently, and it was really interesting to be able to see the questions. And you can take the assessment anonymously. You can use a fake name to just sort of go through it and take it yourself and see what your whole person health score is. So it's a really interesting tool, and I would encourage everyone to take a look at the information that Robin provided.
Good. Good discussion, everybody. Let's see. Anybody else? Is it Vergestein? Did I say that right?
Yeah, that's correct. I was looking and I don't see any of the links in the chat. So is the meeting being recorded?
Yeah.
Yes.
And also I wanted to say that I also have transitional housing, but I don't know who to connect with so that can be a assistance to the community for the homelessness. I'm here in Hemet, but I don't know who I need to connect with to go ahead and provide housing for those that are homeless here in this city.
Wow, that's awesome. Tanya, did you want to say something?
Yeah, I think I understood that you were interested in connecting with someone to talk about providing housing to residents in the city of Hemet. We would love to connect with you. When I say we, this is Tanya speaking on behalf of our Housing and Workforce Solutions team. You can, we'd love to connect with you, and I'm thinking two ways. You can reach out to us at coc@rivco.org, or if you want to drop your name and maybe a phone number and email in the chat box, I'd be happy to reach out to you after this meeting.
I looked at it. I can't get the chat box open. It's like faded out on my end. So that's why I raised my hand and it's not available for me to use it. And I don't know if it's because is this on Teams, correct?
This is on Teams.
Yeah, it's not allowing me to use the chat box for some reason.
Okay, can you write down my email and then maybe just send me your contact information? It's COC.
Yes,
okay.
I'm ready. I'm ready.
COC@rivco.org. And Rivco is RIV as in Victor, CO.org.
Okay, and your name is Tanya?
Tanya, yes.
Okay. All right, I'll do that. Thank you so much.
Okay, is Adrian?
Yeah, hi there, Karen, and thank you so much, Tanya and Monique. I really enjoyed your presentation. I want to ask, I saw the slide prior to where you have the announcements, that the families, I guess, about 1.1% were experiencing domestic violence. The type was pretty small that you are working with on this coordinated entry. What are some of the difficulties that you're still having with placing families who are experiencing domestic violence? I'd love to hear what's happening because we're finding it very, very difficult to get them connected with transitional housing. Tanya, of course, knows the difficulty that we've been having in our area. So can you speak just a little bit? I know we're running late, but could you speak to some of the challenges that you're having, and if you have any thoughts of what we could do as well?
Sure. I think Monique, feel free to chime in, but just overall, we are having the same challenge around housing availability. We do have partners of domestic violence providers that provide housing, and that's both transitional, as you described, and then some that provide permanent housing that will actually work with families to help them secure a new place to rent. And oftentimes, right, the challenge is we can find an available unit and we're competing against 3 other applicants. So the challenge is definitely around availability, and typically when families reach out to us, and if they're in the process of fleeing domestic violence, our goal is always to try to connect them to a domestic violence shelter, where they can immediately be assisted with sort of stabilization services to get to a safe place where they can be free from their abuser. And usually, as you know, those locations are undisclosed. So we partner very closely with Shelter from the Storm, Alternatives to Domestic Violence is another agency who regularly participates within these calls. And then I think about a year and a half ago, we were successful in securing $2 million to provide housing assistance to families. Lighthouse Social Services and Transgender Health and Wellness are the two main providers who are, supporting those individuals. We recently executed a memorandum of understanding between the shelter providers that I mentioned and those housing providers, so we could better facilitate referrals. And we'd certainly love to include you, the Riverside Area Rape Crisis Center. I know Angelina Coe had to jump off. She's the director of Shelter from the Storm, but she is very interested in launching regular case conferencing meetings within domestic violence providers. So when we get those launched, we will absolutely make sure to reach out to you, because I think that's where we really see us creating a space where we can have more discussions on what's available specifically for this population and how do we kind of troubleshoot challenges we have around helping clients navigate this what sometimes feels like an all too complicated system. So very long answer, but to say that we are working on it, and our plan is to get together very soon, form a subcommittee that will work on tackling this issue.
And Tanya, this is Karen. I'm from Lighthouse. I'm on, and I just put my contact number in the chat, and so I'm working to get our meeting together, and so we're probably going to be meeting in November. So I've already talked with the providers. So please feel free to give me a call and give me your you can give me your contact information, and we'll go ahead and definitely include you in our meeting. We'd love to have you.
Yes, and Tanya, you explained it perfectly. That was literally what was going to come out of my mouth, is unfortunately just lack of housing. We need more resources. So any and all transitional livings, any and all, people that are willing to rent to us, like, send them our way, please.
Okay, we're running short on time here. We still have other agenda items to get through, everybody. So I hope you all don't mind if we go ahead and move on to the next agenda item. I'm just gonna be super short and sweet on the BOG meeting. We took a moment to celebrate what we celebrated with you all, which was the $19 million in funding between the encampment funding for San Jacinto as well as the YDHP funding, which is the third largest award across the U.S. Also, this theme of older adults that we've been, it seems to come up again and again as the trends we're seeing. The Board of Governance did approve to allow HWS to apply for ESG funds, and if awarded, to be able to allocate those to DPSS Adult Services, which does a great job helping older adults. So we're excited about that. Also, we did talk to the Board of Governance and get approval to allow HWS to have some administrative authority to be able to reallocate funds if up to $500,000 if for some reason there was an extremely short deadline and we were unable to achieve a quorum. And the caveat with that is that the department would report on what those reallocations were at the next meeting, and that the Board of Governance would take retroactive action. And I think you all know the BOG meets bi-monthly, and a lot of times the department has to move really super fast. So I think that it was a really great discussion, and we landed where we needed to be able to be nimble to make sure we don't miss funding opportunities or don't comply with expenditure deadlines. Because the last thing we want is to lose money to other regions, right? Okay, so with that, we will move on to, let's see, okay, 6.3, looks like Emma, you are on.
Yes, I am ready to go.
Okay.
Mar, please advance to the next slide. Thank you. All right. Thank you so much. Good afternoon, everyone. I will make this short and sweet because I know we are getting ready or getting close to the 5 o'clock hour. My name is Emma Perez-Singh. I'm the admin manager for the Continuum of Care, and it is my pleasure to provide an update on our street medicine bid. We did receive one bid from Healthcare in Action, and an intent to award has been posted this week to award the bid to Healthcare in Action. The recommendation is going to the Board of Supervisors on November 7th, and we are in the process of negotiations with Healthcare in Action, but we are excited to announce that we will be able to provide medical care countywide through our existing targeted street outreach efforts. So this is very, very exciting news for us. And so just wanted to make sure that information was shared with the COC. Next slide, please. On October 16th, the COC submitted the annual 2023 Emergency Solutions Grant. I wanted to acknowledge our team and particularly Natalis for working quickly to get this application completed. We anticipate a response from the state in the coming months, and we will provide an update to the COC and the BOG as soon as we hear from the state. Next slide, please. We also wanted to announce the Emergency Solutions Homelessness Prevention Opportunity. The application is currently open, and it is open to local government entities and nonprofit organizations. The maximum award amount is $200,000 and the minimum is $75,000. Applications should be submitted through the state's eCivis grant management portal. For additional information, please feel free to reach out to us. In addition, you can go to the California Department of Housing and Community Development website, and all of the information for this funding opportunity is listed under the 2023 ESG Homelessness Prevention Allocation. And I'm going to quickly turn the floor over to Natalis to just briefly tell us about COCTA opportunity related to homelessness prevention.
Hello, good afternoon, everyone. My name is Natalis, and I'm the Administrative Services Officer of the Continuum of Care Division. And this is very exciting that the state is welcoming like units of local government, whether it is county or city, and also nonprofit that is recognized by the federal and state government to apply for this funding. And then we understand that because it has to go through the eCivis portal, and then not all of us who may be interested in this funding is familiar with that. And then we have also heard that some nonprofits would like to have more like hand holding and then learn more about that. So that's why we will be pushing out a series of technical assistance. It will be virtual, and then the first session will be on the how to maneuver with the eCivis. And then the advantage of that is that once you are registered on eCivis, and then it would set you up for very good opportunity, very good setup for your future application with the state funding. So it is very exciting. And then please look out for the e-blast for the invitation. Thank you.
That's awesome. Thank you, Natalis.
And I have one more slide here. I just wanted to announce that we are planning our Homeless Persons Memorial Day, and I'd like to thank the City of Riverside for sponsoring the venue for this event. This event will be hosted in partnership with the Department of Behavioral Health. We would like to invite all of our partners to attend. It is going to be at Fairmont Park, and we are coordinating a resource fair for our homeless clients. Between 5 and 6, we will have dinner, a hot dinner available for them, and we will begin our program at 6:30 and end promptly at 7:30. For those of you who attended last year, it was a really great event. We plan to have an equally as great event, if not greater, this year. We would love to have you there in attendance. So for more information, feel free to reach out to us. We will also be sending out this flyer along with additional information to all of our COC members through our listserv. And that is all for me. Thank you very much.
Okay, any questions for Emma? James and Virgistine, your hands up for something new, or was that from previous items? Okay.
Sorry, I forgot to raise my hand down.
That's okay. Just wanted to make sure you didn't have anything you needed to talk about. Okay, let's see. Okay, I believe we have now agenda item 6.4, Greg Rodriguez.
Go ahead to the next slide, Muriel. Thank you. So I'm just going to go briefly over some of the bills that were signed into law by the governor over the last few weeks dealing with homelessness and housing. There weren't a whole lot, so I'll go through this relatively quickly. Assembly Bill 42 basically is a temporary stop on requiring fire sprinklers in temporary sleeping cabins. So again, so this helps with sheltering individuals right off the street without cumbersome building requirements. Assembly Bill 271 allows but doesn't require counties to start collecting data on cause of death for homeless individuals. We actually think this is a pretty good bill, especially so that we can track, substance use, especially fentanyl, and the tragic effects that's having. And then AB 349, this allows local governments and nonprofits to rent unused property at the Patton State Hospital. This is primarily going to benefit San Bernardino County, but we just included it as an overall Inland Empire effort. And then I'm going to talk about Assembly Bill 1377, and then I'll highlight 531 and SB 326 together. 1377 was pretty straightforward and it's just streamlining some processes to get homeless veterans into housing at a quicker rate. So Assembly Bill 531 and Senate Bill 326 are primarily actually around reformation of the Mental Health Services Act, which is now known as the Behavioral Health Services Act. A lot of updates have gone into language around increasing services to those with substance use and behavioral health issues, and primarily around homelessness and unhoused individuals. Now, keep in mind, though, this is for mental health and behavioral health services for the population as a whole. But within the updates in the Senate Bill 326, it changes a little bit of language for broader service. The real key is Assembly Bill 531, which is the Behavioral Health Infrastructure Bond Act. That's a almost $6.4 billion general obligation bond that will provide dollars for increasing treatment beds and units for housing for homeless individuals with severe behavioral health and substance use issues. Both of these have to be voted on by the public, and they will both be on the March ballot for approval. They're the only two ballot measures on the March ballot. And then I didn't put on here, but I wanted to highlight one last one, was SB 43. And that was Senator Eggman's bill to update the language on conservatorships. That language has not been updated in over 50 years. And so this included some language that would have eligibility for those that are experiencing severe mental health and substance use issues. And again, are unable to care for themselves or harm to others. I'll be honest, and I know Monique and if Mark is on will agree that getting conservatorships is very, very difficult in this state. It will still be difficult in this state, but I think some of this language reform will help. I anticipate you'll see a challenge to this law by civil liberties groups. I won't get on the soapbox on why I disagree with that, but I just made my opinion known. But we do expect a challenge on that. So those are the highlights. I didn't want to go too far over time. So
Thank you so much, Greg, for pulling all of that together.
Sorry for my voice. I'm dealing with allergy stuff. So.
Okay, any questions? And I just wanted to, say that I wholeheartedly agree with what you just said, Greg. I feel very strongly about that particular issue with lived experience with family members. So I think more people would not be dying on the streets if we had the ability to do that. So let's keep our fingers crossed that some good things will happen as a result. We know you'll keep us informed. So, okay, you have the updates on the committees, agenda item 7.1 there for you. Also, there are letters of support. This is always super exciting for Michelle and I as your chair and vice chair to sign, and we got to do 3 of those. So you can see the 3 letters that we had the privilege of signing. We always like to see more resources coming into the continuum of care. Know you all do too, so those are available for your review. And then also Moving on, you can see the APRs that have been uploaded for your review as well. And so then we will move on to any calls for agenda items for the next meeting, which is the 15th of November. I think it might say something different. Let's see. Yeah, it's actually the 15th, not the 16th. So anybody have any agenda items? Remember we had talked about having, it'll be a virtual meeting if you are a hybrid meeting, but we will have in person and we will have a little celebration dinner. So any suggestions for agenda items at that meeting? Gina, did you have a comment?
Step back to the next meeting on the 15th. Where did you say it was going to be held? I missed that.
At the city of Corona?
Okay. And
Yes.
City Hall?
Yes. Yeah, we'll get you all of the information on that.
Okay, thank you.
Super excited to host that. Okay. Any suggestions for agenda items? Okay. If not, you can always email the team at coc@rivco.org. Any announcements? Any exciting announcements? I know you all are in the holiday season and busy as can be. Okay, hearing none. You see the upcoming meetings list that is also included on the agenda. Just want to thank you all so much for all of your amazing.
Karen,
yes.
I do have an announcement I forgot. Many people on this call may know or knew Arlene Rosenthal, who headed the Well in the Desert for 3 to 4 decades. Well in the Desert was one of the original food pantries in the Coachella Valley, and then Arlene basically turned it in to a successful food distribution, primarily for homeless, and tying homeless individuals to access services. She did pass away last week from a long battle with cancer. And so just wanted to pay our respects to her because she really was a trailblazer. We didn't always get along, and she'd be the first to admit that as well. But her heart was probably deeper than anyone I've known around this issue. So we will definitely miss her.
Oh, we can adjourn in her memory. Thank you so much, Greg, for bringing that up. Really appreciate it. Okay, everybody. Have a great rest of your day. Thank you all so very much. And I hope we'll see as many of you as possible in person to celebrate the holidays and to celebrate you guys. Appreciate you all so much. Take care. Bye-bye.
Take care. And as always, great job, Madam Chair.
Back at you, Miss Tanya. Bye.
Hey, everyone.